Minute brought to you by St. Francis Health, serving our community for 111 years.
Welcome back. Well, obesity-related liver disease is rising, and now it's the #1 reason for liver transplants. Well, one man was turned down because of his weight, but then he found new life at the Mayo Clinic. Mandy Gaither reports.
In December 2021, Eric Brooks found out his liver was failing. To continue living, he needed a transplant, but he says because of his weight, he was denied that surgery more than once. Without it, he was given months to live.
I wasn't necessarily worried about myself 100%. I was more worried, about my wife and my child, letting them down because, I'm going to die.
Brooks says for 2 years, there was no option for a transplant. Then he learned the Mayo Clinic could perform a bariatric surgery and liver transplant at the same time.
It was just, kind of a Hail Mary attempt it's our last chance to see if we can make this happen.
Transplant surgeon Dr. Julie Heimbach says it's not uncommon for patients to be denied transplants based solely on their weight. She says severe obesity is linked to more complicated surgeries, and a transplant is very complex.
So that approach is understandable, but on the other hand, that leads to patients who have, otherwise treatable condition not being able to access that life-saving treatment.
In 2023, Heimbach performed a liver transplant with sleeve gastrectomy on Brooks. She says treating both conditions set him up for long-term success.
We're hopeful that Eric will have a normal lifespan.
He's now 200 pounds lighter, and the milestones he feared he'd miss are now memories he gets to carry with him.
For me, it's been life-altering. To be able to do things I've never in my adult life been able to do is amazing.
For Health Minute, I'm Mandy Gaither.